All right, just 4 minutes ago, we heard from 6 News reporter Andrew Moore talking about the continued stress on our local hospitals as COVID cases keep rising. Now, according to the state, nearly every local ICU bed is in use, and up to 45% of those patients are dealing with COVID-19. In the Bell County Trauma Service area, more than 20% of those hospitalized in the county have COVID. Up north in McLennan County, it's slightly higher, with 20.4% now of those hospitalized having the virus. And right now, that county has no available ICU beds, according to reports. Now, 6 News reporter Andrew Moore asked today of those hospitals what their plan is moving forward should they not be able to handle such an influx. Andrew, what did they tell you?
Both Baylor Scott and White and Ascension Providence told us they do have surge plans in place if ICU numbers continue to rise, but at the same time, they're going to have to get creative on exactly how they accomplish that. Baylor Scott and White told us in an email today they may need to limit services and adjust staffing to make sure emergency care is available. They may also need to transfer some patients between facilities in order to make room. According to federal data, Scott and White has more ICU beds than all other hospitals in the area combined, 102 ICU beds in total, but they only have 96 of those ICU beds staffed, which means that's the average number of ICU patients they've been able to serve. The Texas Senate Committee on Health and Human Services met about the issue this morning, and this is what the Texas Division of Emergency Management chief said some hospitals are considering.
I mean, the medical directors and the EMS directors are literally talking about bringing lawn chairs and setting them up in some of the ERs for the patients so they can put that 911 ambulance back out on the street instead of having it set in the ER.
The state's emergency management department chief said there is federal money available for counties right now to help hospital systems out, but it's not exactly clear how the funding will be approved. At the same time, the governor has tasked DSHS with bringing medical personnel into the state from other states, but they need funding for that as well. Both Scott and White and Ascension Providence told us today if people continue to not get vaccinated and COVID numbers do continue to rise, it may be difficult to offer those emergency services the community needs. In Bell County, Andrew Moore, 6 News.
Yeah, right in front of the hospital there. Thank you very much for that report and update, Andrew.